Well, hello, everybody. Welcome to week 9 of the NFL season. Halfway there in a long season. We've talked about injuries over the previous 8 weeks. This is our Sit or Start podcast. Again, what we do here is we identify players that were injured in the previous week of football and whether or not they're going to sit or start based on that injury. So you, as a fantasy football player, can determine how you're going to set your lineup. Dr. Hawkins is with us, orthopedic surgeon, sports medicine specialist extraordinaire. How are you?
I'm doing great, Shannon. It's great getting the chance to kind of do this every week with you, and we're looking forward to that halfway point of the season. I think everybody's pretty excited. I know you and I have talked about Philadelphia, so after the big Phillies win last night, my family's riding high.
What is that? I might have missed it. You guys won last night. Are you up 3-1 or what's the deal?
Right now, yeah, we are up actually 2-1 right now because they delayed that game, pushed back the game one day. So we got 2 more games at home, and they've been very strong at home this year. So we'll see how it goes.
Man, that city's going to go nuts. That city's going to go nuts if they win. That is baseball bigger than football and hockey in Philadelphia?
I think it's got some crossover fans, but I would honestly say it's still probably an Eagles town. But you know, they love to blow up when anything goes really well, so they'll blow up either way.
Yeah, that's true. That's true. Well, speaking about blowing up, let's get this thing going here. So the first out of the chute here is Mark Andrews. This guy, boy, talk about being banged up. I think last week it sounds like he sustained possibly a shoulder and maybe an ankle injury, but had gone into the game, I understand, with some knee pain and a slight knee injury. And this guy is obviously their star tight end, but he also suffers and is diagnosed with, I believe, type 1 diabetes. So Mark Andrews.
Yeah, he's a true warrior. When you look at guys that have put in their time and their effort, that guy really just kind of goes out and plays. He reminds you of almost an offensive lineman when he gets out there. So his acute injury, the one that took him out of the game, was his AC joint. So that's that attachment spot for the listeners out there. That's the attachment spot where the end of your collarbone attaches to the top of the shoulder blade. And he came in, you're right, Shannon, banged up into the game. And then he took a tackle and kind of went to the ground and landed directly on sort of the top of his shoulder. And you could see he got up, he let his arm hang down at his side, and then he was out the rest of the game. And every time they showed him, he was sitting there just kind of rolling his shoulder, shaking it out. So he sprained that acromioclavicular joint, what we call a separated shoulder. And so that's a real painful injury. I think that's one of those ones that they can inject it and have him play. But his backup had a great game. There was a guy by the last name of Likely who came in and had an outstanding game. So if he's still a little limited, I would tend to suggest sitting him this weekend because I think he's banged up at midseason and they'd like to have him good for the end of the season.
Yeah, I would agree. That AC joint separation again. Really painful. I mean, a very typical mechanism of injury is that football player athlete that gets jammed, usually in the turf or like in hockey against the boards, springs that AC joint, tears those that connective tissue, those ligaments. But again, we talk about biology here, right? And this is a guy that is just going to take some time for that to heal. But he's susceptible. If he goes back in and gets hit again, it could set him back. So he is most likely, I think you're talking about possibly a sit here.
Yeah, I would go that direction. And just like you said, Shannon, to avoid it becoming maybe a more serious injury where you damage more of those ligaments that support that area.
Yeah. Good point. Okay. Mark Andrews, Baltimore Ravens tight end, is likely a sit. Keep an eye on him over the next 2 to 3 weeks as that AC joint and he heals up. Cooper Kupp. This guy is amazing. This guy's a local Washingtonian, grew up in the Yakima Valley, and played college ball at Eastern Washington, the red carpet over there. And he's just tearing up the NFL as a receiver. But he played when I think the game was out of reach for the LA Rams. And I think there's some people thinking we should have got him out of there earlier. But he stayed in and it sounds like he has a slight ankle sprain. Let's talk about Kupp.
Yeah, I think he's got your garden variety low ankle sprain. So you've got a series of ligaments, those little ropes that connect bone to bone, separate from the muscles, which have tendons that attach it. So those ligaments down at the ankle, I think he had a typical inversion type of an injury. So he hurt those ligaments on the outside part of the ankle. A pretty common injury. Luckily, not one of those ones that's a high ankle sprain. You know him well, Shannon, from him being out here for a long time. That guy is tough as nails. I see him wanting to play through this and get out there and do things. I don't think he's going to miss any time. But I think it may affect a little bit of his mobility, but I would play him.
Yeah, I think I would agree. He is tough as nails, and I think I read somewhere where he's slightly participating this week in practices, anticipating to play. I think you nailed it. It is a low-grade ankle sprain. I think they did an MRI, or they talked about there's no structural damage, so probably just soft tissue irritation, connective tissue stretched out. He is a play this week, most likely. Kupp will play, so keep him in your lineup. That guy is amazing. He seems to be open all the time. He's like a 7-Eleven. He's open all the time. You know what I'm saying?
I love it. I love it. That's a great example of him. I don't know how he does it. I mean, he is quick, but it's like he must make the guys look off with his eyes. I don't know what motion he gets, but he gets everybody turned around the opposite direction, and it's amazing.
Yeah, he really is. He really is amazing. Here we go. Minnesota Vikings wide receiver Adam Thielen. Let's see, what has he got going on? He's got the, you mentioned garden variety. It sounds like he's got a bruised knee. So what do you think about him?
Yeah, we touched a little bit on this last week, and I'm the first to talk about my swings and misses. You know, I said last week I thought that Ezekiel Elliott would be able to play through his bruised knee, and they decided to rest him, and Pollard blew up in that game. So I don't know if I want to call this one, but these guys take hard hits. They'll take a helmet to the knee. They'll land on the turf. I think it's all based upon how he's able to move in practice. If it's just a knee contusion, there's no major bruising in the bone, he has full mobility and strength, and he'll probably play. I don't know if he's quite got the same options as a backup for him. And, the Vikings are in it. They're actually having a decent season with Kirk Cousins throwing the ball. So I think he's going to play. But, again, it's a little touchy subject, these knee contusions. I was surprised when Elliott didn't play last week. Yeah.
When we talk about a knee contusion, again, we're talking about a bruise, usually a bruise to the bone. When you talk about a contusion, and again, you're right. This guy I'm thinking he probably will play too, based on how they're doing. But again, keep an eye on him, because we talked about that it is midseason, and if you've got a game where you can rest someone and get him healthy for the run out, that's not a bad idea. But he's probably going to play. Is that your take on it then?
Yeah, I'm gonna roll the dice on him and say he's gonna play, and mainly because there's really not a lot of chatter with regards to him needing an MRI or anything else major. So I think the assumption is he probably has more of a soft tissue bruise and less of a bone bruise.
Yeah, good stuff. Okay, here this guy's a beast too. They had a great win last weekend. They blew out the Raiders, who seem to be having a challenging year. Mark Ingram, he's got an MCL sprain. Let's talk about the MCL, medial collateral ligament. Very important ligament for a running back.
Yeah, as we touched on before, ligaments attach bone to bone. And when you think about the MCL, that's the big, thick ligament on the inside, the medial aspect of your knee. And I tell patients in the office, think of it like a big piece of duct tape that's stuck from the end of the femur, the thigh bone, down to the tibia, the leg bone. And so when these guys get hit, usually on the outside of their knee, that causes that ligament usually to kind of peel off the bone. So that's why I tell people to think about it like a piece of duct tape. So it peels off. It doesn't usually rupture in the middle when it's an isolated injury. And so they're very painful because they get a lot of bleeding up underneath the ligament itself. And because the shape of your knee is not a perfect circle when it bends, it's actually shaped like what's called a cam, then it actually has to stretch that ligament tighter to go straight or to bend it all the way. So that's why it's so uncomfortable. When somebody sprains their MCL, they'll walk in the office kind of walking on the tip of their toe because they don't want to straighten their knee out and they don't want to put all their weight on it. So he was, had this injury. You're right, Shannon, as a running back, being able to plant and twist, he needs that to be not only stable, but also not painful. So he's going to be a sit this week. He'll probably be in a brace. They'll restrict his range of motion a little bit to allow it to heal. He'll get great therapists working with him like you guys. And then basically what he's going to do is probably have a 2 or 3 week waiting period to see how he responds. And then hopefully back at 3 to 4 weeks. They didn't put him on IR, so I don't think it'll be a long-term one.
Yeah, I read something. He's looking at 4 weeks, for that healing process, that medial collateral ligament. Talk about that medial collateral ligament and as it relates to, sometimes you got to kind of look at that internal derangement. I mean, that meniscus is kind of a good neighbor there to that medial collateral ligament. And you want to make sure that meniscus is not irritated with this injury. Can you address that meniscus a little bit?
Yeah, exactly. So just deep to that, you've got this cushion cartilage between the ends of the bone, the meniscus, and it's deeply invested, meaning it touches up against what's called the deep fibers of the MCL. And
right.
So when you do have that peel-off injury, you have to be, in tune with how does the knee look? Is it just painful? Is it just uncomfortable to test the ligament? Or if that patient comes in and they've got an effusion, they've got fluid in the joint itself, that starts to key in that, there may have been that internal injury associated with it. And so that kind of changes the ballpark completely. That's almost, obviously these guys get an MRI for all of these injuries. But if you're seeing somebody in the office and they've sprained their MCL and they've got an effusion, that's our trigger to say, hey, we need to get an MRI because there's going to be something else going on inside that may not heal like the MCL will heal.
Yeah. I just wanted to address that because that's important to make sure you differentiate between just an MCL sprain or an underlying MCL sprain with meniscus injury. And you're right, he probably had extensive diagnostic work. It looks like he's on injured reserve for 4 weeks. So he's probably a sit for 3 to 4 weeks if you have Mark Ingram. Ryan Tannehill, Tennessee Titans QB, ankle sprain. We've seen a lot of these ankle sprains. Don't have a lot of information on this, but he's questionable. I think they're talking about him being questionable for week 9.
Yeah, I think he's in a unique situation, Shannon, because of where they are. They've kind of quietly stayed at the top of their division. And when you look at what actually kept him out last week, he did sprain his ankle. They did put him in a boot and walking around, but he actually had sort of the quote unquote undisclosed illness, stomach bug. So they kind of had those 2 issues going on and decided to sit him last week, had Malik Willis come in and basically hand the ball off most of the game to their outstanding running backs. This weekend, it's Kansas City for them. They're not going to be able to stay close to that team by handing the ball off. So I'm pretty sure he's going to be somebody they more of a precautionary thing, kept him out last week because he was feeling sick and had an ankle sprain. So I think they'll just tape him up. His mobility days are kind of behind him. He's not much of a runner. He's kind of becoming like Tom Brady now in the pocket. So I think they'll tape him up heavily and he'll play this week.
Ryan Tannehill's a play. That's a good call. Kansas City's a tough team. They need Ryan Tannehill back there in the pocket, slinging that ball. So he is most likely going to be a play. There you got it, folks. That is the Sit or Start podcast going into week 9. Dr. Hawkins, again, as always, thank you so much for your time and your expertise. You hit him pretty good. You've been pretty accurate. I follow what you say, and you're pretty good at this. So thank you again for sharing your knowledge with us.
Yeah, no problem, Shannon. This is always outstanding, and I enjoy doing it with you guys.
Have a great day.